The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Thanks for listening to Meet the Doctor. My guest today is Dr. Jared Mait. He's in Miami Beach, Florida, and he is a functional medicine specialist with a concierge practice. It's nice to meet you, Dr. Mait.
It's great to be here on the show today. Thanks for having me, Eva.
How did you end up in concierge?
Yeah, so the journey was kind of long, but then obvious once I started it. So I trained as a anesthesiologist at the University of Miami-Jackson Memorial Hospital System. And through my residency program, I realized that I was much more interested in kind of like the holistic approach to health and wellness. I was doing a lot of yoga at the time. I was doing a lot of like herbal supplements and learning a lot about nutrition and, taking health into your own hands. And, through this journey, I discovered that I wanted to be a physician that I needed in my own life. And I knew that other people would kind of align with that in their own frequency. And so back in 2015, I started Pulse and Remedy as a concierge medicine practice. We started with no office, just taking patients that wanted to have access to a physician that could show up on their doorstep and provide them with an incredible access to functional medicine, integrative medicine, and general internal medicine. It's grown since then, not having an office to now having moved to our third office. And we have, a cadre of different people on my team that really help to make sure that, the patient journey is fantastic and everybody is hopefully happy and healthy after.
So were you actually driving around doing house calls in the beginning?
Yeah, a lot of house calls.
Were you able to pick up different information about people by going to their houses?
Yeah, it's a great question. So, sometimes when we, as a physician, sometimes we're just asking about the current medical condition, when it started, blah, blah, blah. For me as a functional medicine practitioner, I really wanted to know who they were, what happened before I showed up, but really digging into their lifestyle. So, what are you drinking? How much water are you drinking? How much caffeine are you drinking per day? What does your exercise regimen look like? How are you sleeping? What does your atmosphere look like? Do you use air filters in your home? Do you have plants inside of your home? So, there's a whole cadre and, a list of questions that I like to ask. So when I'm going into a person's house and I'm sitting there and they're a slob and they have Domino's boxes on their counter, or they've got cat dander everywhere and shoes are dirty at the front door, they don't take off their shoes, it provides more insight into, the person versus someone showing up and me not knowing any backstory and they just sit on my sofa and I give them the benefit of the doubt because they're sitting in a clean environment now. So yeah, taught me a lot about each person. And I think the other side was when patients go into physicians' offices, there's this fear. The fear of maybe being diagnosed with something and the fear of being in a sterile environment with a doctor that may spend 3-4 whatever minutes with the patient before they're going to do tests or they just, want to go see the next patient. So this was a different type of opportunity to sit with a patient, get to know them, ask them questions, sit on their sofa, have a glass of water with them. And, there's just like this familiar type of vibe that happens and they feel connected. Like, wow, this guy showed up. He's a doctor, he's here to help me and I feel relaxed. So maybe I'll share a little more than I would otherwise not be able to. So it was great. It's great for everyone.
Did you ever have anything weird happen?
Nothing that's called to mind that was inherently strange. There's been situations that, we would go to outrageous homes where we had to sign non-disclosure agreements and security had to go through our bags. There were house calls at 8:30 p.m. where we're waiting for 2 hours and then, or we get calls from a manager that says we can't tell who it is. And then we wind up in a recording studio with like the world's most famous rap artists. It's anything happens when you start kind of saying, I will travel to you and here's the services we provide, and different types of people show up.
Concierge medicine maybe originally was for the most wealthy people. And I do remember, having conversations 10 or 15 years ago about making this change. How do you do it? How much do you charge? But it isn't just for wealthy people anymore. Is the work that you do available to more people than just the richest rappers in the world?
I think concierge medicine is a approach for patients to be able to access excellent care and people who care for a price. Oftentimes I'll make a comparison between concierge medicine to other professional services where insurance perhaps doesn't cover it. So let's say accounting or tax consulting services or wealth management services or even legal services if a person is involved in, a car accident or, they have whatever it is that they're paying a person at an hourly rate and they're not really negotiating the price down. They're just assuming this person's going to be there to resolve an issue for them. And I think concierge medicine is analogous to that, where there's a value for service and the fee is commensurate with that. We do charge a considerable amount of money, but we provide an outrageous amount of value for it. Our team is pretty deep. So if someone needs something, it's no longer me just showing up at the house and doing everything myself. If a person needs labs, we're sending one of our medical assistants to the house. We're taking labs in their bed sometimes, bringing it back, processing it on their behalf. If a person needs medications because they're sick at home, we're having a delivery service deliver it to them. If they need mobile x-rays or ultrasounds, we're organizing that for them. But then if they're coming into the office, we have a team of people that are, analyzing and setting things up and making sure it's a great process in addition to getting, great medical care. And then, the other part of concierge medicine, I was actually having a call with a private equity investor today, was the idea that our patients, knowing that they're not going through a traditional insurance-based platform, their access to additional treatments is almost opened up where, let's say a traditional internist is going to be working with a patient and they're going to be doing hormone testing. They're not going to recommend certain types of tests because insurance isn't going to cover it. And they're pretty much relegated to providing insurance-based coverage for tests. And most patients aren't expecting to pay anything out of pocket. But when they come to our practice and they're looking for some, medical advice or hormone analyses, we're doing saliva testing, we're doing, dried urine testing for hormone analyses, going down a rabbit hole to truly uncover a root cause analysis of hormonal or any sort of, disturbances in their, functional systems.
Where I thought you were going to go with that was actually down the privacy path, where if you're not going through traditional insurance and you're not asking insurance to pay for something, you have a level of privacy that we don't have anywhere else.
Yeah, I mean, certainly, like, it's not that we're off the grid,
Mhm.
generally, everything is documented inside of our electronic health record systems that are super HIPAA compliant, and every other software system signs like a business associate agreement. So everything is dialed in and protected. We do get subpoenas from times. We do get, insurance affidavits that people need to send medical records. A person was involved in a car accident and they need to get all their medical history. So there's times that we have to open up our records to different parties. We certainly keep privacy, as paramount, top of our practice, but, still everything is documented in a method that patients' charts may be open to the courts, but not to insurance. Like the insurance company doesn't know that we did a test for them. But when it comes down to medications, yeah, I mean, Walgreens, CVS, all these different pharmacies feed into the system. And so, big data definitely has a lot of information.
I didn't mean to go all conspiracy theory, but it's common to worry about where our information is going these days. And it seems like, I don't know, a couple times a year now, we get a letter in the mail that says, whoopsie, your data went to this unauthorized place, or we got hacked, or
23andMe.
Good. Yeah, good example.
Yeah, we've had circumstances that, patients say, I do not want any record of this. And so as long as it's compliant with the law concerning how we have to document things, then we comply, but we're not, we don't have to comply with an insurance-based record keeping.
You mentioned access to 2 other treatments, and I know from speaking to someone else that you work with recently that you have a lot of really innovative treatments right there in the office, right under the roof. Can you tell us more about that?
Yeah, I mean, so, I think you're referencing to STEM's health. So, several years ago, Dr. Ankit Choksi, who's a very close friend and business partner, we trained together at University of Miami residency for anesthesia. He went on to become a double board certified anesthesiologist and interventional pain medicine doctor. So several years ago, we started doing more treatments for um, individuals in pain, but also with musculoskeletal orthopedic injuries, with the understanding that most injuries that are not of a certain severity based on imaging, MRI, X-ray, CAT scan, what have you not, that if they're non-surgical candidates, that they don't just need pain medications and physical therapy, that there's opportunities to use what we call regenerative medicine treatments, orthobiologics. These start with, platelet-rich plasma, PRP, all the way up through exosomes and up into stem cells. And what's interesting is that the Florida Senate several weeks ago passed a bill in Florida that should be going into effect in July, where stem cells will be legal in the state of Florida. And we've been working on a research basis here in our clinics for that, but it will be fully legal in the state of Florida to use stem cells for different injuries. So we're very excited about that.
Were they not legal, or were they just not, was there just no policy or regulation whatsoever?
Yeah, I mean, certain things are inherently illegal. Doing things that are not to standard of care, certainly not getting consent or full disclosure on, the types of treatments we're doing, or making claims that are not compliant with an FDA release statement that these things have been tested for this. So for the past several years, we've been doing things on a research protocol basis where patients have been advised that this is not an FDA approved treatment or method, that the cells that we're using are for research purposes only, and they're participating in that type of, study, and that they're signing off. But obviously, we can't disclaim all of our negligence. So we have to make sure that the chain of custody for the certain cells are appropriate, that we're getting them from a reputable source, that they've been tested. We have a great back office making sure that happens, and we, make sure that we're working with the best providers. When it comes to certain things like platelet-rich plasma, which I think a lot of your audience may have heard of in like vampire facials or doing some sort of aesthetic treatments, those have been pretty standard. So the science is well defined. For a couple of years, different orthopedic injuries have been treated with platelet-rich plasma to reduce inflammation and also help with tissue remodeling. Those have been allowed by the FDA, but sometimes not reimbursed by insurance because they don't allow them for their kind of like to pay. But we've been doing those procedures for a very long time, not only for joints, but also intraspinal injections as well.
What are some ways that you help people with PRP outside of aesthetics?
Outside of aesthetics or
I mean,
yeah, I mean,
what
so
kinds of
from an
things are you
aesthetic
doing with it?
standpoint, we're certainly doing PRP for hair because there is
Mhm.
recognized regrowth using PRP, but mainly our PRP practice is for pain management and joint injections for, pain as well as repairing tissue.
So things like hip pain or
Yeah.
knees
Okay.
or
So specifically, so
yeah.
tennis elbow, golfer's elbow, patients with a tendonitis, patients with non-complete labral tears, rotator cuff injuries, patients with hip pain, just, any joint that has pain, we don't just take pain patients. We need to make sure that they have
Yeah.
an MRI or ultrasound so we can make sure we're providing the right treatment and send them to an orthopedist if it's not the right treatment. We don't just inject. Anybody that's in pain probably needs to either go see an orthopedist or they need to get imaging and come and see us, or a similar type of regenerative medicine facility to be able to understand what's the right treatment for them. But starting whether with steroid injections just to curb the inflammation and pain, all the way through PRP, exosomes, and stem cells. Some great options, and they work.
Mhm.
They work. And now that they're approved in the state of Florida, I think that there's going to be a lot more claims that are going to be founded, based on this does work for tissue repair. This does work for labral tears that are incomplete. I actually had exosomes injected into my knee last week by Dr. Choksi for a partial MCL tear. I do a lot of Kung Fu and Tai Chi. And, as you can imagine, for being 44, there's wear and tear on the body. But over time, we either do nothing about it or we do something. And surgery really wasn't an option to be out of, my normal routine for 6 weeks, all the way up to almost a year, depending on the type of surgery for the repair. So I did an exosome injection last week, and it's already feeling better. And I combined it with a certain peptide called BPC 157. But usually the exosomes take about a month to 2 months to really lay down new tissue and help repair. So, I'm scheduled for a repeat ultrasound in about 6 weeks to see the extent of the exosomes repair. But it's great. It's great to own
How
the
often?
practice.
Yeah.
Yeah.
How often do you get a chance to be the patient instead of the doctor? Not very often.
No. But it felt good. It's, just a quick story. When I was first starting my practice, having trained in anesthesia, I was very comfortable with IVs, starting IVs, giving IVs, understanding the physiology of certain electrolytes and fluid balances and such. And my brother had his bachelor party that I had to be the all-star for because it was my brother. And I was sick with a cold. And I just had a sore throat and congested. I had no energy. And we were leaving the next morning. So I had one of my nurses come to my house, and we had a signature Dr. Mait's wellness infusion where, I mixed a blend of different types of vitamins, 10 grams of vitamin C, glutathione, B complex, magnesium, a whole list of vitamins, and 2 liters of fluid. And I woke up the next morning all better. And it was just like this aha moment in my career, because it was pretty much about a year after, I had started my practice, that this is not a gimmick. This works. Whether it's going to treat cancer or treat a rheumatoid arthritis, I'm not making any claims, but from an immune state and curbing inflammation, it was amazing. And so I had no qualms about recommending that to patients that, were asking me, does this work? And, just to take it back to me being the patient, feels good to be on that side.
You're supposed to have the IV after the bachelor party, not before
Right.
the bachelor.
Note taken. Yeah.
Do you have things like IV therapy there for your patients?
Yeah. At the clinic, we have a room dedicated for IV therapies here, and we do a lot of different types of IV therapies. We do ones for immune function. We do IV therapies for iron infusions. So, patients with anemia, having difficulty absorbing iron, or the inability to take oral iron. Most patients can't tolerate oral iron on a daily basis. It causes stomach pain, constipation, can, interact with other medicines that they're taking. So, we can do an iron infusion, 500 milligrams to 1,000 milligrams, tailored to the patient's hemoglobin and ferritin level, but make it simple. They don't have to think about it and take it for the, make sure they're binding and get repeat lab tests. And we just do it in one fell swoop. But then we have, infusions for detoxification. We do Plaquex, which is phosphatidylcholine infusions for lipid metabolism. So we do a lot here at clinic, but then we also do a lot of house calls. We do a lot of infusions at people's homes, especially NAD. I don't know if you're familiar with NAD.
I have heard of it. Okay. Recently. It seems like everyone's talking about it right now.
Yeah, NAD's become a big buzz in the anti-aging, longevity, and functional medicine space. So, NAD is something as an antioxidant that lives inside of each of our cells. It's responsible for mitochondrial health. It's also responsible for DNA repair mechanisms within the nucleus of the cell. After a certain age, let's say our 30s, our NAD levels start to drop. Not only because we need more NAD, but because our use of the NAD is increased and our ability to synthesize it goes down. Now, what's interesting is NAD starts with niacin, which is vitamin B3. It gets converted to something called nicotinamide mononucleotide, which is NMN. And then that gets further converted into nicotinamide riboside, NR, that then gets shuttled inside of the cell and gets used within the nucleus, or just not only the nucleus, but inside of mitochondria for, its effects. It's pretty profound. I mean, we've used it with patients recovering from addiction. We've used it in patients with depression. We've used it in patients with adrenal fatigue. And we have more side effects that people report as beneficial than the actual reason we're using it. We've had patients that say, I've never looked younger. My skin is glowing. And that wasn't our intention. We have a patient of ours, 57-year-old, who wanted to do it because he was tired. And so we gave him one infusion of 500 milligrams. He just did it for fatigue. And the reason he called us the next day was because he said, my skin has never looked so good. And it was shocking to us that that was the benefit that he was calling about. Of course, he started to feel better because his NAD levels went up, but simultaneous with that, his skin was glowing, and so he's now become a believer in NAD. So we're doing infusions, and we're also doing nicotinamide oral supplementation daily.
So I'm starting to get a good picture of the kinds of things that you're doing in the office and on the house calls. What have we missed? What else? Or can we, if we were going to come see you, what kinds of things could we expect to be able to do with you
Yeah.
as a
So,
patient?
I think what we do really well is deep dive. So if a person doesn't know how their health is, so, a typical executive or anybody who's looking for a really good intake to understand where are they at, where they are on a cellular health level, a physical health level, a spiritual and mind body health level. We do hour to hour and a half appointments, looking at basic chemistries, looking very in depth into hormone analyses, nutrient panels, supplementation, guides, doing GI stool testing to understand different bacterias that they may have, parasites, food allergy and sensitivity testing, looking at the types of foods that may be causing immune reactions, interrupting the normal digestive processes, causing bloating, and just very in-depth panels to understand where they're at in health, and then organizing specialist testing. So certainly we're not doing colonoscopies, but we make recommendations that patients in certain risk categories as well as at certain ages get a colonoscopy for sure. Women should be getting breast screenings, they should be getting pap smears. We don't do those in office, but understanding what the science and research has told us and what they need to be doing, and we organize it. We have a great team to make sure that all appointments are set up for them. They know where to go. We get their results. We review it with them even before the other clinic, calls them back in to review it. So, we do a great job with our annuals. One of the things that we really excel in is in hormone treatments, understanding, as we age, our hormones change. It's just a part of the process, but it doesn't have to be a painful process. So for men, starting, in the late 30s, 40s, we start to notice that our testosterone may be dropping. And as a result of that, our sex drive's going down, our motivation's going down, we have dysregulation of our sleep, our lipid metabolism, like our cholesterol starts to change, blood pressure changes. And so, looking at those things and changing your hormones is not so difficult. So we use different types of medications, different types of supplements before we even get to taking testosterone. But certainly a patient that requires testosterone that the other therapies aren't working or can't work anymore, then we, do that very well. But we also work with women very well as well. Women are traditionally much more subjectively burdened by the drop off in estrogen. Now, the first thing in 30s for women usually is a testosterone drop off, then progesterone in the 40s, and in the 50s, estrogen starts to fall completely until the point of menopause. And once that happens, all things change, all systems change, from energy levels to skin to hair to nails to cholesterol to bone density to sex drive and ability to perform and function. There's really no reason for that to happen, and we can control it. What's really interesting is earlier last year, I think it was the American Academy of Neurology published a research paper that looked at why do certain population groups have increased risks for dementia. And they found that women actually have an 8 times risk for dementia as compared to men, which is incredibly high. And not just Alzheimer's, but all form dementia. You know, there's many like societal demographic reasons for it. A huge one happens to be that hormone levels drop so substantially that it's affecting people's brains. And there's really no reason for that. So, I think the doctor of the future is looking at that today. And I think Western medicine is going to catch up to it in the future. Back in like, the 80s, 90s, women were started on conjugated equine estrogen, which is from horse urine, and it was taken orally and metabolized in the liver with toxic metabolites from that, not given progesterone. And then we saw a rise in breast cancers, a rise in uterine cancers. And so there was a big kind of, don't do this anymore. This is not, this should not be allowed. And a lot of women suffered, and a lot of women continue to suffer based on pretty bad research. But nowadays, if you have a good doctor and you have someone you can trust and you can look at the research yourself and just go on ChatGPT and you can look at the source of that research, you'll find that women should be managing their hormones and there's no reason for them to suffer. So we're doing that really well. And then we're also doing a lot with anti-aging and peptides. We're doing a lot with, promoting healthy aging, understanding what are the things that we need to be focusing on and giving patients a really beautiful way to experience today and, the next 20 years of their life through movement, through medications, through supplementation, through, guided protocols. So really try to make my life on this planet, purposeful and worth it. If I'm going to be doing this every day, I really want to have my patients go, I'm really glad I met that guy. He really gave me some time.
Have you been helping people with weight loss using GLP-1s?
What's that? Just kidding. No, I'm
Ozempic.
Yeah.
Oh, you're wow.
Yeah. No, I've been living under a rock.
The guy under the rock.
Yeah, I'm under the rock. But we have peptides there. I think GLP-1s have been a game changer. I think that for many reasons. I think their weekly dosing has been pretty fantastic. It's pretty easy for, patients experience. Very small needles, so patients can do it themselves. They have incredible outcomes. Dose-based side effects certainly are manageable, but I think that there's more and more research coming out that they've applied for more and more FDA studies looking at their ability to not only curb addiction, but blood sugar regulation, lipid metabolism, Alzheimer's disease. So, I don't think there's a drug that cures people from themselves, but I think this is one that really helps people curb their own desire for things that perhaps they don't need to be doing.
Have the GLP-1s changed the way that you yourself have thought about weight loss with patients?
Yeah, it's the only tool really in the arsenal from a medication standpoint that works for most patients. There's other medications that, have been somewhat effective, but overeating and obesity is a real problem. Most diseases can be controlled by the things that we're putting in our systems, not only from overeating, but, eating sweets and candies and processed foods and things that come out of bags and, are in bad aisles of the grocery store. I think a lot of people say, I'll start exercising when I lose 20 pounds, or I'll start going here when I start losing weight. And I think this has augmented that. This says, okay, well, it's been 6 weeks and you've lost 22 pounds or whatever it is. And, let's get you to the gym. Let's get you working out with a trainer. Let's get you into a yoga class. So, I definitely think it's helped the idea of patients getting fitter quicker.
What do you like to do when you're not at work? You talked a little bit about martial arts, and I think you said yoga. You say yoga a lot. You must love yoga.
These days I do more Tai Chi than yoga. But I think a lot of those things, I think that the ancient healing arts are not being replaced. I think that people are just forgetting about them and they're assuming that Western medicine is more advanced. I think Western medicine is reproducible, and I think it's pillable, and I think it's injectable. But I think that those healing arts were founded thousands of years ago, and they're based on a lot of people doing them and with a lot of great outcomes. I think Tai Chi is a brilliant art. I think it not only calms the mind, but it also opens the body. It improves our breath. And I think the things that we're doing for ourselves every single day are more fundamental to our health than any medication or any test or anything that we're kind of waiting to do or getting results back from. So, my health recommendations for patients are pretty much, what do you do every day? How much water are you drinking? How much, how many hours are you sleeping? Are you meditating? Are you stretching? What are you eating? Those are the big questions, not, does your stomach hurt?
Yeah.
Because you can get a lot from what they're doing every day. And then you probably go, oh, your stomach must hurt. Like, Wow, you're not
That's
meditating? You're probably pretty anxious all the time, right? Am I wrong?
tiny incremental habits stacking up over time.
That's right. So when I'm not at work, well, I have a new baby boy who I'm
Oh,
obsessed with. Yeah, he's great. So he's 5 months old. So I'm playing with him when I'm not at work. And I have an amazing wife. So when I'm not playing with him, I'm playing with her. Um, I play a lot of music. I write a lot of music as well. So I have a home recording studio. So, I do that. I read a lot. Right now, I'm just finishing second volume of Shogun. I don't know if you ever read that book, but
I didn't.
it's a journey, a couple thousand pages. I didn't know that when I started, but it's like watching Breaking Bad. You just kind of stay with it.
And you can't put it down?
No, it's down. I'm not reading it the second,
No.
but yeah, no, it's great. It's if you have any interest in samurai, Bushido, and feudal Japan in the late 1500s, it's incredible. It's like an alternate reality, just how they valued life and the honor that they gave and their sense of something called wa, like WA, which, the Japanese live in an island that's the size of California with about 180 million people. That's pretty much half the population of the United States fit into California. But they live in a relative sense of peace. And this concept of wa is the individual in the collective. And what that means is the individual not disrupting the flow of the collective, because the peace and the rhythm and harmony of the group is more important than the individual. And it's pretty beautiful. It's like a flock of birds. No one's going to fly out of line, because then it messes them all up.
I'd like to ask kind of a funny question at the end. The question is, when you're on an airplane and they are looking for a doctor to help someone in a medical emergency, what do you do?
Yeah, I just look around to see if there's anybody who says, yes, I have a doctor in English, to stand up first.
Has it ever happened to you?
It's happened. They'll say, is there a doctor on the plane? And usually I'll press the button.
Yeah.
Someone will come over and say, oh, we have a passenger in 38B who is having a panic attack, or, things like that. But it definitely gets my heart racing. Here I am on an airplane. There's no backup. I'm the guy.
Showtime.
It's showtime. Yeah. It's, did I bring my consent form? No.
Yeah. Always worried about
legal.
risk.
No, but yeah, it's an honor to be, needed, especially in that setting when, things are not always as controlled. You don't have the supplies, you don't have your team.
Do you have a story?
I mean, I have a great story. When I first started my practice, so back up, when you finish medical school, you think you know everything. You've taken your boards and you start, practicing medicine. I'm going to go in, I'm a resident, I'm going to start. And first day on residency, I got called to a code. And you kind of learn pretty quickly that you are not a doctor yet. And, it's obviously that you're in a teaching hospital. So you're being called as the resident, but there's an attending, there's medical students, there's senior residents on your staff as well. So, that's a wake-up call to, I better know what I'm doing, because this person's calling for the doctor. And then when I finished training in my residency, a couple of months after that, I had started my practice, Pulse and Remedy. And I was at a fundraiser in the Hamptons, and for Hillary Clinton. And the hostess of the party was in this big, beautiful $200 million estate and watermill. And she stepped on one of the concrete kind of backyard flooring, and her heel went through the middle part in between two concretes, and she twisted her ankle and she fell. She hit her elbow and she hit her head. And,
Oh, no.
It was almost like the music had stopped and everybody was looking at her. And I saw it out of the corner of my eye, and I ran over, and someone just called, is there a doctor? Is there a doctor? But, in today's economy, there were no doctors. Everybody was a real estate developer and a hedge fund magnate, private equity, or, lived a life of dependency. And so I went over with the Secret Service. We carried her into a back room. And then there I was in a back room 2 months after starting my practice. Bill Clinton's on my right. Hillary Clinton is on my left. I have blood in my hands, and I'm examining this very frail cancer survivor patient who had just taken a spill at this fundraiser. And, it was that same moment coming again. You have no backup. You have no other physicians, no nurses. What are you going to do? And, I called 911. No, I'm kidding. But I assessed and I treated and we monitored, and I didn't go back outside, and I just sat with her. And she turned out to be, great. But it was a great opportunity to shake President Clinton's hand with blood on my hands, which is, kind of an interesting.
That is a good story.
Yeah, the life of a doctor.
Mm-hmm. You never know.
Yeah, so
where you're going to end up.
That's that.
Amazing. Thank you for sharing that. That's a good one. Well, if we're listening today, if we've made it this far and want to get to know you better or potentially come see you, what should we do?
Yeah, you can give our office a call. You can go online. So online is pulseandremedy, all spelled out.com. You can go and call us at 305-699-6963. You can go on Instagram to @DocMait, DocMait, or you can go to our online store at maitmethod.com. And then if you're interested in any of our kind of regenerative medicine treatments with Dr. Choksi, you can go to Stems Health. Just type that in Google. We should probably come up first. But type in Stem Cells Miami or Stems Health, and you'll see us. You can read all about us, the treatment we do, get a sense, read our blogs. We definitely spend a lot of time writing about what we're doing, the innovative treatments, and the law concerning it. Find us, reach out. We'd love to help you. We'll make it convenient. We'll make it worth your while.
And we'll make sure we get all those links in the show notes so they're easy to find. And I'm so glad that I got to get to know you today. I feel like I already know you.
I feel like I know you too,
Thank you,
Eva.
Dr. Mait.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.